Hello, my name is Emily Jackson. I'm a second year student at the University of Arkansas for Medical Sciences, studying rural and global health. My presentation topic is economic instability and discrimination, which are two huge topics to cover. In this presentation, I plan to cover the who, what, why, when, and how surrounding the correlation between economic instability and discrimination. Before we start, for those who are unaware of what correlation is simply stating that two factors may influence each other, but there's no definitive proof of such causation. Causation implies that there's definitive proof of two factors being linked to one another. Now, let's go more into discussion about what exactly is economic instability. So, as I stated in the last slide, what is economic stability? I'm sure that's a big question on everyone's mind. Economic stability is a critical issue all around the world. Economic stability is the ability to provide or receive enough income to buy necessity. I'm sure that we have all at some time been in a place of economic instability where we cannot afford to pay for something that we really wanted or something that we really need. That is a common thing here in the United States. There are a lot of individuals here in the United States. They're unable to buy the necessities that they need. Economic instability is also a social determinant of health because this issue affects the quality of life, health, education, proper housing, and transportation for people of color or other minorities. Economic stability is one of those things that controls how you live your life. Your quality of life can be bad if you don't have enough money to be able to get on. Also, we find that when someone is economically stable, they can provide better for their family and they are able to spend more time with their family, go to ball games, do what they need to do with their children. We're going to move on to the next slide. Now we will discuss how economic instability affects socioeconomic status. According to the Kaiser Family Foundation 2020, most minority communities in Arkansas live in poverty. 29% of African Americans in Arkansas currently live in poverty. 20% of Hispanics live in poverty. 23% of multiracial individuals in Arkansas live in poverty. Meanwhile, only 13% of Caucasians in Arkansas live in poverty. So this leads one to question, why is there such a statistical difference between each race? Could it be discrimination, social stratification, or the current job market? We know that economic instability can affect one's access to education and quality of life. Often, minority students are placed into school that are unable to maintain or even afford new books. This predicament leaves the students unprepared for the real world. It also makes secondary education seem like a burden. Many minority students will never be able to afford education or even have money to stay in college. Meanwhile, socially economic stable students can afford university and finish their degrees. For example, if a student lives in a low income neighborhood, this student is more likely to receive subpar education than those who live in wealthier neighborhoods. Economic instability often leads to minority individuals relying on Section 8 housing for housing and public transportation such as buses for transportation. According to public housing statistics, Section 8 demographics and more, 5 million households in the United States are on some form of Section 8 housing, whether it's the housing voucher program or simply living in the projects. Often minorities do not make enough to buy or maintain a home or a car. Currently, the average cost for a new 2023 car is about 48,000. Schultz 2022. I found that interesting. With a traditional 72 months financing, a monthly car note would be around $667 per month. Now, I personally do not know many people who can afford that amount each month. However, with economic stability, they could move out of Section 8 housing and afford a used car. Economic instability can also lead to an unhealthy diet and a reliance on food pantries. Many minority communities do not have access to healthy foods. They have to rely on more microwavable foods, canned foods that are quick and easy to make. Minority children may not receive enough vegetables and fruit for their daily function. Often minority communities must rely on these food pantries to provide what they cannot buy. And food pantries have different hours and they offer more canned products than fresh products. Yet economically stable households can go to Kroger's or go to Whole Foods. Economic instability can also be a factor in domestic violence within family. In low income families, domestic violence may be a norm. According to the American Psychological Association, domestic violence is correlated with unemployment. Often, people who are domestically abused quit their job due to pressures from their partners or lose their job due to their inability to be present. And this can lead to prejudice among minority communities. Economic instability also affects the quality of health for people of color. In Arkansas, most residents rely on Medicaid or Medicare for health insurance. However, if individuals do not qualify for health insurance, many are forced to go to urgent cares or emergency rooms for preventative health. Also, economic instability can invoke depression and anxiety in individuals. And as we know, mental health services are not cheap. Thus, health insurance is critical. Economic instability can prevent individuals from getting dental or optical care that are vital for everyday life. In an economically stable position, individuals can receive the best quality of life they deserve. Now, I'm sure you're wondering, why are we talking so much about socioeconomic stratification and discrimination? Well, the reason why we're talking about this so much is that my social exposure for this class is a mixture of several social determinants of health. So, my primary focus was on how social stratification can lead to discrimination within minority populations, especially people of color, and in the workplace. And that's where my main focus was for this topic. However, we do know that discrimination covers a lot of different categories. There's also racial discrimination that could be described. There could be age discrimination. There can be class discrimination, gender discrimination. Um, the list is infinite about different types of discrimination, but I narrowed mine exactly to social. Next, we will talk about measures for socioeconomic stratification. So there are various measures to measure socioeconomic stratification, such as the Duncan Socioeconomic Index, the NAM Powers Occupational Status Score. You can compute proportion from cross-sectional investigation of minority groups, economic well-being, and their impression of discrimination. Or you can use census-based information about financial positions such as poverty and wealth. I decided for my topic that I would measure the socioeconomic stratification and discrimination through a survey using the Likert scale of and open-ended questions on how socioeconomic stratification can lead to discrimination and standardize these survey questions. And I'm sure you're asking, what is the Duncan Socioeconomic Index? What is the NAM Powers? And to answer those questions, the Socioeconomic Index is used to quantify financial status. And this list depends on data from the census. Now, the NAM Power Occupational Score, it operates as a work-related standing measure. Normally, the Duncan Socioeconomic Index and the NAM Powers rely on income and education. The NAM Power is really focused on occupation. Now, we can also do the proportions. The problem with the proportions is proportions would require us to do actual data collection, which can be time consuming if you don't have the time. And census data would also need to be delineated along the minority population. In regards to what I would like to use for the survey, I would like to give a short description of what the survey would look like. So my first question would be, for example, how much socioeconomic status hinders someone's ability to advance in life and in the workplace? I would ask them to explain any effects in detail. I chose a survey questionnaire as a measurement approach because it allows contributions to be descriptive but also quantitative. People would also feel comfortable and have no pressure. Restrictions on survey questionnaire are the need for incentive to partake. People may feel like they need something to partake. Um, and most online reviews are kind of general now. A lot of people are doing surveys online. Um, Also, surveys are not very adaptable, and they may not work for people who do not like discussing questionable subjects. Also, another issue that we may come against is those that incentivize non-willing participants can skew the results by non-response, causing a non-response bias. These are all things that can be considered as um, a limitation to using a survey. So this slide is talking about how economic instability affects the distribution of disease within population. So there are several ways that psychosocial outcomes, behavior outcomes, psychosocial exposures, and behavior exposures impact financial instability. Psychosocial outcomes affecting instability is the rise of mental health problems among adults and children. Someone can become insane when they lose their source of income. And suicide is one way that behavior outcomes can be affected by economic instability. Some people decide to end their life because they cannot handle the stress. Oberstein et al. States that a study of the Great Depression revealed that there was a decrease in earnings, which led to a growth in suicide and medication use. In addition, Goldstein also discusses how psychological and social distress caused by poor economic conditions can harm adolescents' mental health. A child can be affected by malnutrition and neglect within the home if the parents are suffering financially. Financial strain can result in decreased social support and negative family relationships. Two additional ways economic instability can affect psychosocial outcomes. Due to the fear of being a burden, financially struggling individuals choose to isolate themselves from their family. Additionally, when someone loses their job, they lose access to workplace support. Stuckler et al. States that a rise in suicides and homicide is associated with a growth in unemployment. A lot of people choose criminal activity in their free time to generate income for their household when they are unemployed. And rise in suicide attempts and deaths and thoughts are another way behavior outcomes impact economic instability as well. How Van Hall states that people without jobs are three times more likely to kill themselves, which is a shocking statistic. There has to be something that we can do. So, in this slide, we will discuss how economic instability affects the distribution of disease within populations. Continue. So, psychosocial exposure can be impacted by economic instability in several ways, including the induction of inflammatory cytokines and psychological stress. Sturgeon et al. States that financial stress increases inflammatory promoting cytokines and can prolong psychological distress. The African American community has held on to this idea for a while. In this community, discrimination has always created a psychological distress. African Americans are more likely than any other group to activate inflammatory genes in stressful situations. Scientists have also found out about weathering within African Americans. For those who are not sure what weathering is when stress shortens Black people's lives, basically. And also influencing financial instability is depression and anxiety brought on by financial stress. Calano states that the transition period between jobs can increase the risk for individuals to have to use antidepressant and have depression and anxiety, which is another thing that we should try to work on as well. So next we will talk about how economic instability gets up under the skin, literally. There are several ways that financial instability gets under the skin and into our brains to affect health. The biological outcome affecting economic instability is the rise of the study of epigenetics among adults and children. Bergman et al. States that DNA segment methylation and acetylation can alter gene expression. So epigenetics is a relatively new study. During the Great Depression, many people lost everything they owned. And if we were to study their DNA, we possibly could find traces of methylation and of acetylation of their DNA and how it affected their gene expression. The stress pathway and DNA methylation raises the risk of breast cancer, small cell lung cancer, borderline personality disorder, depression, Alzheimer's, post traumatic stress disorder, chronic kidney disease, and hypertension, which are all serious issues to be covered. Now we'll talk about how economic instability affects the brain. The hypothalamic pituitary adrenal axis appears to be a pathway through which economic instability penetrates the body. Our sympathetic nervous system derives a hormone called cortisol, which is released by this HPA axis. And this cortisol is a hormone that causes the fight or flight response. And Berkman et al. States that elevated levels of cortisol can raise the risk for diabetes, heart disease, and cancer. Through tissue remodeling and modification to the brain structure and function, financial instability can also enter the brain. Berkman et al. States that stimuli-induced physiological changes can alter a cell or tissue's original purpose. For example, the distress from a financial instability case could allow a cell to become cancerous and metastasize. Another way economic instability can affect The brain is through neural modification. Berkman et al. States that a small amygdala and hippocampus have been linked to financial hardship. Now, some people may not know what the amygdala and hippocampus are, so we're going to give you an idea. So, according to PNAS, our capability to be afraid of anything is processed by the amygdala. According to Anad Devad, learning and memory are controlled by our hippocampus. These are two small but major parts of our brain that can be paralyzed by economic instability. In conclusion, economic instability and discrimination have major roles in various parts of our lives. Economic instability and discriminations are major concerns that need to be tackled now. And in the future, there should be emphasis on generational wealth and health. You may hear that a lot, but health is wealth. This is my works cited page. Please feel free to go through it and look. This is also the works cited page continued. I just want to thank you for your attention. And if you have any questions, please feel free to contact me at ejackson3@umas.edu. Thank you for your time again.